All right, great. Hello, gang. It's good to have everybody back. We're here on March 7th, 2019, and we're doing another version of Lunch with the Doc. And today we're talking about ADHD and the generation of prescription pills when it comes to this, and where our kids are coming from, and the teachers that are pushing this stuff. And, doctor means teacher. And I take that role very seriously. Half of my job is getting people to feel better, but the other half is getting them to hold on to stuff and to understand how to maintain momentum in their health spectrum on that beautiful, healthy version of themselves that we talked about in some previous discussions. But let's dive into this a little bit closer, because this is a big topic. And you got teachers telling parents that their kids need drugs when they don't sit or they don't do the things um, that the teachers are asked, and then when they challenge the system, and instead of having doctors actually go through and prescribe drugs that may help behavior, you got teachers and nurses, assistants, and faculty at schools that aren't trained to discuss this information, giving their opinion and giving their ideas and planting seeds inside these parents' heads about their children. And I couldn't disagree with it more as far as the practice with this. So let's go and let's dive into this. Let's talk about attention deficit disorder. So ADD, ADHD, attention deficit disorder, attention deficit hyperactivity disorder, is commonly identified with children that have a difficulty paying attention or controlling their behavior, aka any kid can fall underneath this stuff. Over the past 10 years, we have witnessed the rate of children diagnosed with ADD and ADHD increase over 50%, which is insane. The potential for overdiagnosis has caused a lightning rod of controversy within the medical fields, both in the doctors, the prescriptions, and these doctors are speaking out about the number of prescriptions that are filled each year for these powerful stimulants. I mean, these are versions of cocaine when it comes down to Ritalin and Adderall, as far as the chemistry that goes in to with trying to elicit a certain response. So this matters. I mean, providing powerful psychoactive medications to children has significant set of risks without providing any cure. They give no coping mechanisms, no ability for the child to understand, why we're having these ups and lows and highs, and ups and downs, and the variety of our feelings, and then it comes into not a matter of control, but it's that I don't have the right drugs in my blood system, and that's just, it's insane that this is where we're progressing, that we're willing to give up our freedoms, for a little sense of security. This comes down to our vaccination policies, as far as in California and some other mandatory things. I mean, there are ways to get around these things, but the trend of where we're going is that we're taking the ability for parents to parent, and we're allowing 1%, 2% of the population to thrust an agenda out there that is just going to a whole bunch of confusion and misinformation. And for today's purpose, we're going to be focusing on how quick we are to jump to a drug or a prescription to try to alter behavior or try to alter a response. And anytime that we're working with patients, we talk to them about, I mean, there's some really good drugs out there that can take away pain, that can take away this stuff, but you got to understand that it's masking it. It's not truly addressing the mechanisms, the chemistry, the biochemistry, the neurology behind it. And it's trying to throw chemistry in to elicit a reaction. And the problem with that is that everybody responds to chemicals and medications a little bit differently. So, and this is why the leading healthcare organizations have begun to encourage a much more conservative approach to managing ADD and ADHD. A simple suggestion that we make in our office all the time is omega-3s and inositol, which is a standard process. You combine those two things, and you will see significant changes in children with ADD and ADHD, and it gives them the coping mechanisms using essential fatty acids and some essential nutrients in there to balance the system out. So adding conservative care such as behavioral therapy has been shown to eliminate some of the use of medications for nearly 40% of the kids. So what a concept. We slow things down. We take a closer look at it. We teach the body instead of drug the body. And as a result, we have 40% of kids coming off of medications, which should be the whole job. It should be the whole deal. Anytime that somebody walks into our office and says that my doctor, my neurologist, my medical doctor, my psychologist said that I need to be on these drugs for the rest of my life, you know, that throws up a red flag. That throws up something where we want to take a closer look, check these drugs, see where they're going, see what kind of adaptive physiology is going to happen in the body, and try to come up with some natural alternative approaches to get the body to function better. And that's what it all comes down to, is a lot of these behavior and energy and attention issues that we're discussing here is that we get them out to exercise, we get the right foods in them, and teach them some meditation. I mean, all of a sudden when we start, it takes a little bit more work, absolutely, but this is where we start building up the lifestyle habits to live a healthier, better life. So the American Psychology Association has recommended that behavioral therapy as a first line of treatment for any kids under 5. And let's bear in mind that these drugs, the Ritalin, the Adderall, have not been tested on children under 18 because they legally, the pharmaceutical companies legally cannot test under children under 18, even with a parental signature. So, I mean, you got to understand that we're putting our kids on these high doses of stimulants and psychoactive drugs with no real long-term testing for children under it. It's after the fact, when they turn 18, that they can get a little bit more detail on this. So simple things like exercise elevates the levels of dopamine and serotonin and can increase focus and attention. Just like when we're talking about people about exercise and their energy levels, and they're saying how low their energy levels are, and you need to go exercise. You need to create the need for energy, and that means that there has to be at least 30 to 40 minutes of activity just to get the body to function the right way. We need this stuff as part of good nutrients. And obviously reducing sugar while increasing protein and high fiber foods can help stabilize those energy levels. So here's the big thing that I want you guys to take away from this, is that there's alternatives to the drugs out there that are for ADHD. These drugs aren't tested under children under 18, but they're highly prescribed, and they create dependence upon this stuff. And you watch, we got an opioid epidemic right now, but it's going into this. The opioids have just been there longer, and the drug companies knew that they're going to make money on it, and they flooded the market, even knowing what they were going to happen with this. This is the same thing, because no parent wants to be told that their kids are not normal. So take this drug so that your kids can be more normal and get along with everybody. And that's the last reason anybody should be taking some drugs and taking drugs to normalize their children. Personally, I want mine to be as excited and challenge the system as possible, challenge the system as much as possible. I want them to be respectful. I want them to understand that there's people that are elected or are part of their community that are leaders and people to look to. But I want them to challenge that system. I don't want them to be drugged out in the corner and just going along for the ride. I want them to be part of it, participate, and set a path. So our practice has worked with many families who have had children diagnosed with ADD and ADHD. And the first part is you have to normalize the nervous system, normalize that neurologic output from the brain to the rest of the body so that the body can handle all the sensory input as it comes in from what we see, touch, taste, feel, and experience. The other thing is that you want to find some natural treatments, other things that can work in here. I mentioned a couple, omega-3 and anisotol, which is a standard process product, work really well to curb that down. And these are part of essential fatty acids and vitamins and minerals that the body can actually process. And it's not a chemicalized, it's not as much chemistry added to the system. So, I kind of got into this fast without actually talking about where our research is coming from, just because I'm so passionate about this. I'm number one for the easy way out. I like to make sure that things are done right and they're done properly, and that when we're doing when we're making those decisions, that we go through the costs and rewards benefit, and that at the end of the day, we're trying to do we're trying to get the right efficacy from every treatment that we're doing, as far as where we're both trying to get the parents with their children, as far as the children and their scholastic and social careers. So these drugs will alienate some of these abilities to communicate properly. And there's more and more research out here. Today's research is coming from actually a 20-year study, and it's titled 20 Years Trends in Diagnosed Attention Deficit Hyperactivity Disorder. And this is from Growing Up with HDAD in the Pediatrics 2018. I mean, this is new research that's coming out. I love this research, particularly because it was accumulation of over 20 years of study. So there's a lot more into this as far as ADHD. We discussed colic last week. We have some more things that we'll be discussing over the next couple of weeks before we have our March 27th workshop on things that every parent should know about their kids and how to keep their kids healthy and drug-free. So if you like what we're saying here, you agree with it, you have some comments, you have some questions, please like, comment, share this with your friends out there. And I appreciate everybody showing up here today. Thank you so much for your time. Oh, wait, we got some questions coming in here. 1 second. Okay, so yes, inositol and omega-3s are good supplements to actually be going through. There are some other things, but they're a little bit more personalized. And like I said, we want to stay away from the sugars. We want to stay from the starches, the complex carbohydrates, and you really want to get to those essential building blocks. And that's protein, essential fats, essential fatty acids. So yeah, no. The omega-3s, the question on omega-3 was how many. I've told many people that your body gets saturated with omega-3, so you got to change your sources on where they come from. And my recommendation is that if you get a Nate Choice or standard processed supplements, by the time the bottle runs out, get a different source. We got tuna, we got krill, we got a combination of everything. It really goes from, take the bottle and then switch to something else so that the body can absorb it better. So yeah, March 27th, the workshop starts at 6:45. If you're not a patient, you can go online to our Facebook page, or people are sharing this with non-patients. You can go to the Facebook page for Disc Centers of America Fairfax. You can get some tickets. You can come in here. They're free. Like I said, doctor means teacher, and we take that role very seriously. I love getting people better, but what I really like showing people is once they're better is what they actually get to gain from that. And thank you guys again for all your hard work and your continued focus on this. And I'll see you guys soon. Picture in picture.